Dealing with infertility can become a bit of a complex issue just with the amount of research that's coming out on how patients might actually struggle to conceive. And we're realizing that it goes a lot more beyond than what we previously thought, in the last decade. So we're learning more and more research of new factors, new tests, new potential treatment options. And it's a big investment that healthcare providers make for our patients to try and stay up to date as much as possible on this rapidly incoming research, and it's growing very quickly. And one of the most important topics we've realized may actually impact fertility and chances of conceiving for patients since about 2018, as more and more research is coming out on this, is the role of the microbiomes and how the microbiomes in various sites of the body can actually positively or negatively impact chances of conceiving. So first off, a microbiome is the type of bacteria or microbes that will coat or inhabit the surface of a specific tissue or organ. So more specifically, what we want to chat about today is the gut microbiome, so the microbiome of the digestive tract, plus the microbiome of the reproductive tract. So that would include the lower and upper reproductive microbiomes, which more specifically would include the uterus, cervix, and vaginal canal, respectively. So what we're seeing over the last few years is how the gut microbiome is actually very different for patients who are fertile and don't have any reproductive issues versus patients who have, for example, polycystic ovarian syndrome or PCOS. We see there's an increase in type of bacteria or microbes that actually can worsen insulin sensitivity, affect inflammation. And another condition that we see that is similarly affected via the gut microbiome, where it differs, is patients who have endometriosis. Patients who have endometriosis, we see a drastic increase in the gut microbiome with bacteria that are associated with increased inflammation and poor or worsened estrogen metabolism in the large intestine, in the digestive tract. So we're seeing that the gut microbiome is altered in patients that have these conditions. Now, whether it's altered because they have this condition or because the gut microbiome itself worsens this condition is still up for debate and controversial, but we know these bacteria are associated with these other issues like increased inflammation in the body, like mentioned earlier, as well as worse insulin sensitivity, poor blood sugar control in some cases, and then altered metabolism of sex hormones, particularly estrogen. So right now what we're seeing is actually new research on another condition that can be affected negatively via the gut microbiome potentially. And this is for uterine polyps. Now, uterine polyps, usually there's no real treatment. Like, it's something that patients have to speak with their healthcare provider, the fertility clinic, and if it's severe enough and the doctor believes it's going to impact fertility, they'll usually refer the patient to have it surgically removed if they think that's indicated. So it's really interesting to see how the increase in very specific microbes in the digestive tract are correlated with increased likelihood of having uterine polyps. In fact, in this new research published, they're trying to use these bacteria in the digestive tract, which they will detect via what's called PCR analysis on a stool sample. They will actually see higher levels of various bacteria, but three specific bacteria that show up at significantly higher levels in patients with uterine polyps. Include Streptococcus, Fusobacterium, and there's a third bacteria that I can't remember the name quite right now, but all three of these bacteria that they saw in increased levels in patients that had uterine polyps in the digestive tract are associated with chronic inflammation, increased knee pain. One of the bacteria is actually commonly found as a causative agent or causative microbe for periodontal inflammation, gingivitis. So these are microbes that are usually associated with increased inflammation and more inflammatory states. And they're usually found in higher concentrations around colorectal cancer. So actual lesions, cancerous lesions in the digestive tract, will see higher levels of some of these bacteria as well. So again, it's that causative, question of, is it the bacteria that causes the lesion or the inflammation, or is it the fact that there's an inflammatory tissue there and that leads to increased populations of this bacteria, or is it actually a synergistic where it's a little bit of both? That we're still learning about. But we're seeing that the higher levels of these types of bacteria is actually associated with an increased likelihood of uterine polyps. And it's not just infertility, non-fertility. They compared this in a study where they took patients who had endometrial polyps and had infertility versus patients who had infertility but no endometrial polyps, and then versus a third group, which is no endometrial polyps and they were fertile. And we're seeing specifically it's the patients that have infertility and endometrial polyps, they see these types of bacteria actually significantly elevated compared to patients who have no uterine polyps, whether they're fertile or infertile. They will notice this increase. So it helps to highlight how the gut microbiome has a very significant impact and potential role in reproductive health. And with the research building up on this topic, it becomes more and more difficult to really ignore this, especially for patients where they have unexplained infertility or patients that have been going through this process for years now or have done multiple treatments and aren't really seeing any changes or the desired outcomes. We start having to look at, is the gut microbiome a potential avenue where we'll find the answers we're looking for. And similarly for patients who have miscarriages or recurrent miscarriages, we're seeing how the changes in the reproductive microbiome are actually significantly associated with risk of miscarriage in the first trimester. We're having pregnancy-friendly microbes that reduce inflammation, support pregnancy, and then having more inflammatory bacteria like Prevotella, Gardnerella, Trichomonas are actually associated with potentially an increased risk of miscarriage as well. So manipulating or modifying the microbiomes can be of significant impact, and we see that in clinical practice quite frequently, where just by changing the gut microbiome, we see patients with PCOS, for example, who have suddenly significantly improved blood sugar control, insulin sensitivity, patients with chronic endometriosis, that once we adjust the gut microbiome, a lot of them will notice that they're having significantly reduced pain or chronic inflammation, decreased chronic pelvic pain throughout the cycle, throughout the month, but also during menses as well. And then similarly for patients who have had unexplained recurrent miscarriages, how simply adjusting the reproductive microbiome afterwards led to a healthy pregnancy in various cases. So it's interesting to see now that with uterine polyps, there may be an association between the gut microbiome and the risk of having uterine polyps. And it'll be interesting to see in future research if the gut microbes that we're seeing that are increased actually have a causative effect in increasing the chance of developing polyps, or whether they're a result of having uterine polyps. And often patients will ask, what's the connection between the gut microbiome and the reproductive microbiome? Why, how, if you have a bacteria in one organ, why is it affecting the other organ? And in the research, they hypothesized three different mechanisms for this. One is just the proximity of the orifices, so there can be a sharing of certain microbes there. The other two potential methods where one microbes in one tissue can affect the other is the connection between the reproductive tract and the digestive tract via dendritic cells. So there's a high hypothesis that certain microbes can actually migrate from the large intestine to the reproductive tract via these dendritic cells. And the third hypothesis is actually they may not travel, but they cause a change in the production of certain inflammatory cytokines and mediators, which can then influence or encourage the growth of other microbes in the other organ there.